Thanks for the pen.
Oh, no.
Yeah, it's my favorite t-shirt.
Oh. Welcome back, guys, and thanks for joining us tonight. Another episode of Scrubs coming at you. I am Dr. Todd, by the way.
I'm Allycia.
Thank you guys for being here. This is my wife, by the way, for those of you who are new around here joining us. We've had a couple comments lately, people asking about that. So,
I also had a comment asking what I did or do for a living.
what do you do for a living?
Well, I don't even know anymore. I do all the things. But
International
I used to
Woman of Mystery.
No, I used to be a hairdresser
Yes.
for like 20 years.
I guess not medical. I think some folks were curious if she was medical. So not technically, but I feel like hairdressers and nurses have a lot in common.
Yeah, that's very interesting.
And I've met a lot of nurses who like started out as hairdressers and then, or like vice versa.
Yeah, so I remember in hair school, there was a lot of people that dropped out of nursing school and came to hair school. And I was never in that. Like I had zero interest in the medical field. Still, I mean, I learned a lot from you, but...
Yeah, I had zero interest too.
Really?
I'm kidding.
It never made sense to me, but maybe it had something to do with caring for people.
Yeah, I think so. Taking an interest in people, like providing a needed kind of service.
Yeah, maybe. Yeah.
Make them look good, make them feel good. You know? Anyway, so that's the backstory there. I don't know. We're going to jump into Scrubs here. This is titled My Philosophy. So we're going to see what that's all about. If you are new around here, consider hitting that subscribe button. Help us keep growing. We're having a blast hanging out with you guys week in and week out. On that note, we're going to jump into Scrubs.
What's it called?
My Philosophy.
Oh, you already said that? Yeah. Oh, okay. I didn't hear you, or I wasn't paying attention.
You never care. All right, let's do it.
All right.
Well.
Oh.
But my parents will kill me if I marry a black guy. So you can ask Carla? I'm doing it. You sure? Positive. Nah! Tonight I'm gonna make her a nice dinner and then I'm gonna put the ring in her champagne glass. You might as well put it in her champagne glass.
What are you guys talking about?
Nothing. Guy talk.
Nope, nothing
bitches and hoes.
Bitches and hoes.
I just have to get changed.
What the heck?
Have you two met?
I was wondering. Yeah. Oh my God.
You're overcompensating, you're gay, and you need to be okay with it.
Oh, yeah? If I'm gay, how come I work out so much?
What?
It's tough to be a woman in a co-ed locker room.
Is the Todd gay?
They want you to dance.
She likes the attention.
She's going to get into it.
Obviously, this is in JD's head. Or was that in her head?
Did they have a shared vision?
You didn't know. It's gonna be hot.
I'm absolutely fine, honey. I am here with you.
Never better.
Just go in.
Mommy, why are you calling so late? She's dead? Yeah, I'll be right over. My Aunt Marie's dead. She's only 60.
To one hell of a lady.
Oh, no, Turk, no.
No.
You should be with your mom right now.
Yeah.
Thank you, baby. Stay out of trouble.
Yeah, gonna have to holster that one for a little while, Turk.
By the way, Elaine's back.
Elaine's been on top of the heart transplant list so long, she's in and out of this hospital almost as much as I am.
Was that Ellen DeGeneres?
You don't get into bed until I come here so I can see your booty.
If I finally get a damn heart, I'll let
It was not.
It feels so weird to be sitting around hoping someone's family pulls them off life support.
Actually, so that's a really common thread with being on a transplant list is you can imagine like how complicated it would be to be hoping for an organ, but recognizing simultaneously that what that means. And so that is a weight that I can't even imagine having. I mean, obviously, like, again, you're going to be ecstatic the moment, say, your loved one is able to live as a result of something. And then, of course, you cherish, you honor, and you respect what that organ donor did. Some of the medical shows we've watched, actually, we've actually seen this bit of a recurrent theme, and that because that is obviously a natural thought process.
It's like when one person dies, another person gets a chance to live. I like to call it the circle of life.
Oh, gosh.
My God, you must stop watching The Lion King.
I was waiting for a Lion King joke.
What's his name? Simba. Trick question. You like it too.
That's funny.
Excuse me, Elaine. I actually need his opinion on something.
Ooh.
I'd say she's pregnant.
Just a terrific catch there. Yeah, I heard mitral stenosis and I need an extra set of ears. Let's go.
It's kind of flattering that you'd choose me.
Ears. Newbie, ears, not mouth.
Dr. Koppelman has notified me that he will be vacating the office next to mine. His deteriorating health has made it impossible for him to continue on.
Dear, should we send him a card?
If you can find one that says, crippling arthritis or not, I want you out of my hospital by sundown so I can knock down your wall and make myself a giant office.
You're a wonderful man.
Never change, Kelso.
Man's office is a reflection of who he is.
Yeah.
I say he doesn't want to come in my office then.
Come on. Oh,
Oh.
it makes no sense.
Hey, get the ring back?
Did I get the ring back? Dude, I'm back, okay?
No.
He's gonna eat it. No.
All right, so I got somebody to cover for me tonight. Gotta open them. Oh, you're killing me, Ralphie. You are killing. No, you did not just swallow that thing. Yeah.
Well, Turk's a surgeon.
Yeah.
Go fishing.
I am through taking my clothes off in front of men.
I think I can speak for all of us when I say we'll live.
We have a co-ed locker room? Hot damn.
It's like, where have I been?
Yeah.
Write it out on a piece of paper and slip it in my suggestion box.
Kelso's office expansion. I wonder if that'll be
Oh.
where the female locker room needs to go.
Yeah.
Really? Yeah. Ted, show it to her.
Suggestion bin.
Sorry.
So, this locker room, do you have to be a doctor to change in there or what?
Take this one. See? You don't always have to be like, blah, 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 blah. You can be like, hey, how you doing? I'm good. This can work. We can be there for each other.
You have a valvular defect in your heart.
Oh, God.
Relax, Steve. He's a worrier.
Me too. I'm a worrier.
Pregnancy puts such an extra strain on your heart that had we known about this condition beforehand, we would have strongly suggested you think twice about even getting pregnant before getting the valve repaired.
I would have done it anyways.
What is that guy from?
Got a healthy supply of pluck about you, don't you?
I can't breathe.
You're okay. Let's do this.
Love the pluck.
Mitral stenosis. We'll talk about that at the end.
Hey, Nancy.
My gosh.
Okay, I want you to imagine that there are tiny men inside your booty. Push the dookie out, Ralphie. Can you imagine that for me? You told my son there were little men inside? He barely sleeps as it is.
You know, we've never had a situation of a swallowed ring, thankfully, but we have had a swallowed. Well, okay, no, we thought our son perhaps swallowed a battery. So we'll break that down because that is not uncommon. Coins are another pretty common thing, and so we'll talk about like what we do on the medical side if we have a concern for this and like things that might be able to safely pass through versus when it's an emergency and you go in. And there's also radiographic signs that you can look for with like coins specifically to determine if it's airway or esophagus because that distinction matters a lot. Yeah. So we'll break that down a little bit later.
If you could do this for me, I would greatly appreciate it. The next time your son has a bowel movement, take the dookie and just call me on my cell phone. It's for my girlfriend.
Oh. Could you say why?
Pushing it out. Pushing it out.
No, I think the Larkins complement each other. They're a good team. Kind of remind me of us.
Roseanne, now,
Roseanne.
you just compared us to a married couple. I know, a girl can dream, but this is never gonna happen.
Get in here.
She went into atrial fibrillation.
Oh.
What the hell is going on?
Sometimes it's hard to find the right words.
Oh my gosh. You don't recognize them? No.
Dr. Kelso, I demand a female locker room.
Mm-hmm.
Good for you, Elliot.
Yep.
Sometimes the words don't come out at all.
No reason.
No.
Yeah, it sucks.
If we don't deliver this baby, your wife could die.
What's gonna happen to the baby?
We're gonna do our best.
Did they ever say how far along she was?
I don't think so.
So you're telling me if we don't deliver the baby now, my wife could die. And if we do, our child probably won't live.
I wish my life was more like my favorite TV show. Oh, come on. Death isn't that bad. Especially if you're dying from laughter. You're on candid camera. No, I'm not.
She was in on it.
Yeah.
Mr. Larkin, we need a decision from you here.
I'm not ready to do that. There are lots of people who think the hospital would be a better place if we made some changes. Take Ted, for instance.
I feel I'd be more productive if my phone dialed out.
The hell out of my office. Not you, Ted. Ted, get the hell out of my office.
I'm gonna miss you so much.
I'm only going to Chicago for 5 days. I'll call you when I land.
Baby, don't go. Thanks for the pen.
Oh, no.
Yeah, it's my favorite t-shirt.
Oh.
My favorite skin.
I don't think you people are getting how difficult this is.
Trust me, I wouldn't want to have to make this decision.
I wish I could ask my wife. She'd be better at handling this than me.
You know, you and I are a lot alike. Throwing a headlock and draw a mustache on, but in crunch time, we always come through. It's time.
Dr. Reed, are you off?
Oh, I just didn't have a place to change.
Laverne, I'm going to pretend you're not wearing that.
Don't you usually wait till you get home before you do that?
Go Laverne.
According to county statute, all medical facilities in this region are required to provide single-sex bathrooms and change rooms for their employees. Put that in your suggestion box and smoke it.
Where'd she learn all that legal mumbo-jumbo?
She's been talking to Ted.
What are you doing, Ted?
I'm trying to whistle, you know, so you wouldn't think it was me.
Stop the cab! Whoa! Hey, open the door! Baby,
Park!
Take it.
Sorry, ma'am.
Oh, gosh.
It's the waiting I can't take. I just want to know one way or the other, you know?
I got an idea. Why don't we switch to a cheerier subject?
Yeah, Dr. Cox doesn't like this
I
topic.
know.
What do you think death is like?
It's like a big Broadway musical. Everyone's all dressed up.
I think it's like a game of dodgeball. But then you wake up in the hot nurse's office, and when she leans in to put that bandage on your nose, you get a sense that something could actually happen if you just took a chance and buried your face in her knockers.
With the school nurse.
I think death is a lot like that story, quite frankly, but if there is a God, it'll be a lot quicker and half as painful.
It's fun to annoy him.
It's what I do.
So I hear they're making that office into the ladies' locker room,
Yep.
huh?
I do like when Elliot gets a little confidence
know.
about her.
Well, I'm here doing a research fellowship, so I'll be anywhere from 15 to 25 years.
That's a long time.
Yeah.
And pretty accurate.
You'll probably be dead.
Oh, look at his face.
Will you marry me?
What did you say?
Think I said, will you marry me?
Turk, wow.
I got a ring.
Kind of.
It's in a safe place.
I can't believe this. I've imagined you saying this to me like 1,000 times. I just never imagined that when you actually ask, all I would say is, I need to think.
What?
Well, her aunt just died.
Yeah.
That's what I was hoping to hear.
I love you. I really do.
Love you too.
And I can imagine there's so many emotions going on right now with her that
Yeah.
I could see this.
Probably should have just waited till she got back.
Probably.
I guess sometimes my whole theory about life and death balancing each other out in the hospital doesn't hold true. I guess sometimes you get lucky. What's going on?
She's holding.
I was going to say, as soon as he said that, I'm like,
Yeah.
no.
Feel the waves come crashing.
Come crashing down.
See a very long way.
Be okay?
Yeah.
Well, I hope for her sake a Broadway stage was waiting.
Yeah.
All right, so we had another somber one here.
I know.
They do that every once in a while.
Bring it back to reality.
Yeah, I mean, the concept of, and which I know we've talked about before. So although in a situation like that, somebody's on a transplant list, so they likely have pretty significant cardiomyopathy. And so if someone like that does code, you would, assuming they were still a full code,
Yeah.
you would obviously do your best, but you would know that, I mean, the the probability of success in a code like that is almost none.
Yeah.
Because they're in essentially like cardiogenic shock. And, the success rate for coding someone is pretty low anyway, frankly, but especially throw in a very weak heart. So, yeah. And then, of course, we had the contrasting. So you had the pregnant lady who had the heart issue, although hers was a little bit different, mitral stenosis, which we'll break down that a little bit.
Yeah.
And then, of course, this other lady, which she was relatively young. And so it's hard to know exactly maybe what like her medical history was, but likely had developed a dilated cardiomyopathy. So a very weak heart. So anyway, yeah, death, very challenging always.
Yeah.
I don't know how much I'm going to add to that. Because and we talked about this actually on one of our other reaction, one of the other like animes we're watching, but losing patients is unfortunately a common part of the job. I mean, death in general, right? I mean, death comes for everybody.
Yeah.
Right. So we all are witnessing it and then of course going to experience it ourselves at some point. Now, when you're in the medicine field, you experience it a little bit more frequently.
Mm-hmm.
And, I know it can sometimes sound callous, like, doctors do have to try to find a way to detach at least a little bit from that kind of emotional pull, I suppose, because otherwise it's like, how can you go on to do your job? There was that episode earlier in this, I don't know if it was season 1 where, Dr. Cox was talking about like, the surgeon was in there giving them the bad news and he made the comment like, he's going to do that and he's going right back to work. Right.
Yeah.
And sometimes that can actually help us. Like we bury ourselves a little bit in that. And sometimes that happens too. And we'll say outside of professional obligation where, when you lose a loved one, that bereavement period is hard. And sometimes, it's not uncommon for folks to bury themselves in work or in activities to try to distract themselves. But that's the thing. Grief, it's not, you can't outrun it.
Mm-hmm.
Like it's going to find you. Sometimes when you least expect it, and it's going to hit like a wave over and over and over again. So you do have to process it eventually. So that gets really challenging. And then, of course, we talked about this in another where like up to 50% of, if not more, of folks who've lost a loved one will experience a bereavement-induced hallucination where they actually have an encounter where they feel like they see or smell or have an awareness of their past loved one. And that's that, because it's that, the brain gets into these like sort of automation, if you will. And so even though cognitively we know that this person is passed,
Mm-hmm.
because things get so repetitive and because we rely on those repetitive like thought matrix, I guess is the term I'm looking for, then you can experience that. So that's sad. And I know that's, oh, go ahead.
What if I give you a non-medical view of that? And what if it's not your brain actually making that up for you and it's just you're, how do I want to say it? You're tapping into that other side.
Yeah. So this, I guess this launches into a much like bigger philosophical debate of what does that quote afterlife look like? And depending on, I guess, your religious background, what your faith maybe leads you to, are ghosts real?
I don't even think of it like that.
You don't think of it like that?
No. I just think that they, from wherever they are, wherever you believe they are, that they can check in on you, let you know that they're there.
Maybe.
Mm-hmm.
Yeah, I don't.
Obviously, we can't disprove that.
Yeah, you can't. And I don't know, like I've never experienced like a true, see, I'm kind of thinking of it from like a ghost perspective.
I'm not. I'm thinking of it from a spiritual perspective.
Well, and then it makes me think like, do you think aliens are real? I'm kidding.
Do you? You're the one obsessed with all the alien shows.
So here's the thing. Are all of those people lying? I have a hard time believing
Same. Other way.
Well, yeah, so I agree.
All those encounters.
I agree. Like, are they all lying?
Right. No,
I can't see that they're all lying.
You're saying you've never experienced anything like that.
So the other thing I want to talk about.
You're not going to talk about it, see?
The other thing I want to talk about was, why did I wrote down battery?
Deflect.
Oh, no. Okay, I was like thinking battery. Okay, swallowing, our son swallowed, well, we thought he might have swallowed a battery. So, yeah, so like, okay, this is actually not an uncommon thing in medicine that we'll see. So if coins are probably one of the most common, and if a child swallows a coin, if it goes through the esophagus into the stomach, a lot of times you just let it be because it will pass, kind of like this, right? Like the ring will eventually pass. Now, that ring looked like it had some rocks on it. And so like diamonds and things. And so that actually could be a little more concerning because that can damage the lining.
So I was like, why didn't they x-ray him?
Well, yeah, you would have.
Yeah.
But like a smooth ring, though, you're probably not going to be as worried about. And then coins, now, because if it goes in the airway, so if you like swallow it and it happens to go into the airway, that's a big deal. Now, you might think, well, hey, the person's likely going to be having trouble breathing and stuff. And that maybe is not always true initially because it could kind of get stuck on like one of the rings of the trachea or something. And you could still move air back and forth initially. But anyway, x-ray, like, so if they swallowed a coin, if you can see the face of a coin, like the circle is actually like towards you, then it is likely in the esophagus. If it's turned where you almost just see like the side of it facing you, then you think that is likely in the airway. Now, these are not perfect, like 100% accurate all the time, but that's a pretty good gauge. But honestly, you're going to want to do a lateral film as well. So not just the AP films, which are straight on. You want a lateral as well so that you can see it from the side because that's going to help you truly determine this. Button batteries have become a common concern, although I guess they've been manufacturing button batteries a little differently now.
Are they? I didn't know that.
To be like safer. Because those obviously, you have to go in. If they're in the esophagus, doesn't matter. You have to go in because those can actually cause something called liquefaction necrosis. So they can eat through the esophageal lining, actually form like a fistula with the aorta, and then you can bleed so catastrophic. You're gonna die if that happens. But it's interestingly not from the chemicals inside the battery. It actually can form like a circuit with your esophagus. Like it actually creates an electrical current.
Yeah, that's not cool.
So not cool. Not cool at all. And then I wrote down mitral stenosis. So that's a problem with opening of the mitral valve. And so the way we remembered it in medical school is stenosis, opening. And so you're going to hear that murmur when the mitral valve is opening. And that's going to be actually when the heart is in relaxation mode because the mitral valve is the valve inside the heart. It opens to let the ventricles fill up with blood. And so then it closes. And then, of course, the ventricles then pump blood out into the body. And so you listen, like when you're listening for these murmurs, you're trying to determine at what stage of the heart pump cycle this is. Now, mitral stenosis, typically because that calcification around that valve, it's going to make it hard to open. And so you're going to have less blood filtering through the ventricles. So you're going to get decreased cardiac output from that. You also may then have like blood backing up. So dilating the atrium as a result of that, which then everything kind of goes backwards from there. That can be problematic. And Dr. Cox is right. Pregnancy tends to complicate this. In some cases of mitral stenosis, so depending on the severity, you could watch it for a while. So I wrote that down, thought it was interesting. Should we share the story of my proposal to you? Since we have a proposal episode.
Yeah, that wasn't very... It's pretty similar to that.
Yeah, so, it was, the end of a long day, like... I think it was raining out in tin roof. You could hear it. It was like a summer evening. Hold on. And, we just got done like getting the animals in, feeding the hogs and stuff. And then I just remember sitting around the dinner table and, I had like a little piece of like twine from like when I was doing like the runners on the green beans outside for the farm. And, I was just like twirling it around and kind of made like a little ring shape. And I said something like, "We say we get married."
Are you trying to quote a movie or something?
No.
He's made up the story. Yeah. Wow. Okay, so I think what we have highlighted here is Dr. Todd has shown us how, I don't know if it's like, or the skill of deflecting, or what was it that we said, how doctors detach and they bury themselves in their work because he did not want to talk about that. Okay.
Anyway, so no, the story of our proposal was actually very, very simple. We were very young, and honestly, it wasn't even in person. It was over the phone. It was over the phone.
Yeah, so long ago.
I know, but I will, for sake of time, we'll maybe cut that short, unless anybody really wants to hear like the full-on story. But one of these days, maybe I'll share the story. I did on on the Office compilation about the ring I bought you. But anyway, I think that's all for tonight. Mm-hmm. You good?
I'm good. Maybe one day you'll share your story. It won't be today. That's okay.
I will. So
you've only shared it with me.
Anyway, yeah. Look, I mean, the point I think is, and kind of look at this lady. She didn't fear death, and I think that's a good place to be. Especially somebody who is sick and the risk of dying is higher. This is hard. I do have patients sometimes who are in not good health, older, and sometimes they have a strong fear of death. That's sad to me. And it's, and obviously my goal is to delay that process as long as we absolutely can for them, as a physician, right? But obviously, that it's coming at some point. And now, and granted, it could come for all of us at any point. Like it could happen tomorrow. It could happen tonight. We don't know. But I think, I don't know. It's how do you get to that point where you feel like you're sort of at peace with it, with the idea of it. I don't know. Food for thought. I guess it's going to be different for each person. So on that note, hey, we're going to call it quits for tonight. Thanks for being here for this. I like this episode. Made us think.
Yeah.
Please consider coming back for the next one, guys. Till next time, take care.
See ya.
I am Dr. Todd.